common question we get as clinicians are, what are the best core exercises? Well, there's been some scientific study of this published in the Journal of Orthopedic Sports PT looking at a few movements, and the November and May issues 2010 looked at some core exercises on unstable and stable surfaces, as well as doing some other movements. Personally, I think that a lot of those movements are not very practical for our everyday patients. They are a little bit high level, as are the movements that I'm going to show. These movements are definitely for your advanced clients and your advanced patients. These are not for your low demand patients. These are not for home health patients. These movements are mostly outpatient, end stage, rehabilitation, return to sport and athletics. These exercises are from Stuart McGill, who is a biomechanist at the University of Waterloo in Canada. He has done scientific, rigorous investigation on healthy athletic subjects with these exercises. So I want to go over them. There are 4 movements. The first one is called the curl up. This is called the McGill curl up. Supine, one leg down, hand behind the small of the back to make sure that you maintain the normal lumbar curve. Opposite hand behind the head. The movement is going to be a lift the head off, hold for 5 to 10 seconds, and back down. The curl up is going to be a lift off as if you were lifting your head off a bathroom scale. 5 to 10 seconds, 5 to 10 reps. Repeat the opposite side. Hand on the small of the lordosis, hand behind the head, come up. I'm going to add a little bit of twist to this. I'm going to add that candle core breath that I've emphasized in our course. As you come up, you go in through the nose, and as you come up, get that breath. As you get that breath, you got to get that compression. You got to improve the quality and the control of the diaphragm, the top half of the core. The next one that McGill stated is called stir the pot. Stir the pot is a very difficult exercise. If you want to try it, give it a whirl. There's a couple of ways to do it. First, you can do it on your knees. And basically you're going to stir the pot in a clockwise or a counterclockwise manner. More advanced method is going to be split your legs wide, same thing, and then you got to do a clockwise, counterclockwise kind of movement, 10 repetitions each way, called stir the pot. McGill also has an exercise called the bird dog. Bird dog is done very similar to what we're familiar with our quadruped movements. We're going to draw in a couple little different tips and tweaks to this. As described by McGill, it's going to be a reach, and then come back, touch, reach, touch, 5 on that side, and then repeat 5 on this side. I'm going to put a little bit of emphasis on the breath with this again with my candle core. I'm going to exhale, and also I'm going to really make sure that I reach as far as I can to that wall, as far as I can with my foot, so I'm getting that nice force closure going through with elongation of my fascia. As described by McGill is side bridge or side plank, you may be familiar with. Little difference in the way that he instructs it is opposite hand on shoulder. This is to prevent the pressure down on the opposite trochanter and causing activation on this side of the body. Change the center of gravity, put more emphasis down on your obliques, lateral hip stabilizers, in through the nose, out with the candle core. Hold 5 to 10 seconds, repeat on the other side. The next station is used TheraBand, heavy TheraBand, or cable columns. These are advanced exercises. These are level 4, starting to get into your more skillful athletic movements. This is not for lower demand patients. You can do these motions without using resistance in some of your lower demand patients and then progress to resistance. The first one is basically a chopping motion. I have TheraBand. You can also use cables on a high pulley. I'm going to put my hands in this position here, and my motion is going to be a chop down, come back up. A chop down. It's not a pull down with the arms. It is a draw in of the abdominals, and then a belly button rotating to the knee, then come back. The second of the 3 more advanced movements using cables or TheraBand is a anterior punch. I have my TheraBand and my cable. I'm going to draw in about 20%. I'm going to lunge and rotate, anterior punch, come back. Lunge, anterior rotate punch. Again, not leading with the arm. You're basically going to get to this position and then rotate that torso and then finish the motion with extension of the left arm. Repeat 10 reps, go to the other side. Next one is a lateral pull. TheraBand or cable, elbow up, feet together, lunge, elbow out. Elbow up, feet together, lunge, elbow out. Again, it's not moving any motion with the arms. Common training errors is just stepping and reaching. Those are the three. The next station is for more of your lower demand or early phase core exercises, and they all follow the same principles. Candle core breath in through the nose, purse the lips, blow out. Remember in the course we put our hands on our abdominal region and we blow out. We can feel that closure going on. So if you have somebody that is home health, acute care, you want to work through some breathing exercises. First one is going to be a standing off the edge of the bed, wheelchair bound patients as well, or in home health. We're going to put our hands together in a diagonal fashion. We're going to blow out and come back down. So a nice fundamental breathing exercise. Number two, hands together. We're going to get thoracic extension. We're going to raise our arms up over our head and blow out. A little bit of a tip here, when you get to the very top, blow out and reach for the ceiling. As you reach for the ceiling, what are you going to get? Some nice closure going in with the compression because of the connection between the thoracolumbar fascia, internal oblique, and the diaphragm. So if you get that blowing out, you're going to get that compression going on. Take your patient or client, get thoracic extension this way. Feet up, a little bit of posterior tilt to the pelvis, get elongation into the lat, extend, breathe in, blow out, elongate. Breathe in, blow out, elongate. Elongate. Always make sure you get that extension. If you get that extension, you're getting the tensioning on the latissimus dorsi thoracic. Supine, one leg down.